Firefighting in Canada this week is brought to you by VFIS of Canada, a division of CVIS Incorporated, Canada's largest insurer of firefighters. In this edition, the University of Regina is conducting a study aimed at improving the mental health of first responders. Then, BC's Gabriola Island firefighters have been driving ambulances amid paramedic shortages. And a court decision shoots down Ottawa Airport's plan to conduct random drug testing on firefighters. The University of Regina and the RCMP have joined forces to look at how officers are trained to avoid post-traumatic stress injuries. The RCMP PTSI study is a part of the Federal National Action Plan on PTSI. The study officially began in April 2019, involves nearly 1,000 RCMP cadets, and could run as long as 10 years. It will follow participants from their first day on the job through their first 5 years of active duty. This will allow for continual assessment of the training efficacy as they experience the job. Nicholas Carlton, lead researcher and professor at the University of Regina, told CBC that the effectiveness of current preventative training programs have not been adequately tested. The goal is to strengthen research and increase awareness about the importance of mental health prevention over intervention. The RCMP study results are expected to benefit the mental health of study participants, RCMP, and other public safety personnel by mitigating PTSI among those who served, stated a protocol paper published on August 17th. Firefighters in Gabriola Island in BC have been left driving ambulances on several occasions due to paramedic shortages. Fire Chief Will Sprogis told Global News that twice last week, fire crews had to operate ambulances. Global News reports this has resulted in members of the island's volunteer department investing their own time and resources into getting Class 4 driver's licenses, which is required to operate ambulances. Sprogis said that the department's primary focus is on fire protection, with medical as a secondary operation, but operating ambulances isn't a part of their job description. BC Health Services reported that firefighters have been called to drive ambulances 17 times this year. The Divisional Court dismissed Ottawa Airport's plan to conduct unannounced random drug testing on its firefighters. The decision came as a result of a lack of evidence of substance abuse problems within the airport's fire crew. The National Post reports that the Ottawa Macdonald-Cartier International Airport Authority implemented the testing in December 2018, with firefighters' unions agreeing to testing on its employees when suspected of being impaired. The unions opposed to the requirement for random testing. An arbitrator originally upheld the airport's policy, citing a decision from 2017 involving Toronto Transit Commission employees. The workers' privacy rights have also been weighed against safety concerns, reports the National Post. The Divisional Court has also dismissed the airport's suggestion that Canada's legalization of cannabis has made it more likely for firefighters to show up to work impaired. Thanks again to VFIS of Canada, a division of CVIS Incorporated, Canada's largest insurer of firefighters. Stay tuned for our next episode on Friday, September 19th.